Here we go. All right, everyone, Dr. Anika Beckman here, and I'm excited to talk with you about Julva, answer any questions that you may have regarding your feminine health, sexual health, bladder health, questions about your sex drive, vaginal dryness, vulvar issues, and other problems that you may be having. So we'll go ahead and get started. And I'm going to share my screen and go through some slides here in just a second. And we will go ahead and mute your audio if you're not muted. Have you go ahead and mute your audio, and otherwise we'll unmute you at the end to ask your questions. Sound good? So I'm going to share my screen. All right. Minimize myself there. Put this down here. All right. All right, so let's go into our Julva question and answer section. And this, I promised you, was an Ask Me Anything session. And before I get started, I do want to know I am a physician. I am actually triple board certified in gynecology and obstetrics, anti-aging and regenerative medicine, and now in integrative medicine. And however, everything that I'm going to share with you today is for educational and informational purposes only, and are not intended as a diagnosis, treatment, or as a substitute for professional medical advice. Your relationship with your physician is sacred, and so only through there you will have your diagnosis and treatment. So please consult a local physician or other healthcare professional for your specific healthcare and/or medical needs or concerns. All right, so let's Julva, right? Sit back, relax, let's talk about Julva. So I want to ask you a quick question, and again, you can enter in the chat box. You hit that little chat button and you can answer this. Which of these are the most worrisome for you, right? Women deal with all these things. We hear about this every day. Our customer service people, staff, they hear about issues, fears, concerns, questions, what's going on with their, vaginal health, with their hormones, with menopause, when they've had hysterectomy, if you're dealing with depression or anorgasmia, leaking of urine, if you've had surgery. So we get all those questions. I want you to list in the chat box just what is bothering you most, if you care to share that with us. And I'll take a look at all of this through the end. It really helps help you. And I want to ask you now, if you are currently using Julva, to just type yes in the chat box too. I want to know about how many people listening tonight are currently using Julva. And I know we have a lot. We've had such an enormous amount of people during this Julva promotion sign on to be regular subscribers. They know it works. They like it. They're in for the long haul. And consistency and patience, right? Those are keys to getting the optimal health, getting to exactly where you want to be, to persevere, to persist. And so continuous usage is important, not to mention just being able to get Julva delivered regularly and not have to remember or to run out. That makes life easy. So just write yes if you're currently using Julva and you want to share that information. I definitely want to hear your experience with it. And this is a picture of me in my old car, my 1966 Delta 88 Oldsmobile convertible. And I always say, it's the old things well taken care of that keep turning those heads. And so you can nod your head there if you agree with me. And for sure, I always say, made the same year I was born and considered an antique. There's something wrong about that, but needless to say, it's a good analogy. All right, so you ready to get your feminine back? And what does that really mean, our feminine sexy back? So a good sense of self, right? A good sense of being present in our body and comfortable with our body. Wherever we are, whatever age we're at, to have intimacy and connection, to be able to experience pleasure, and definitely to have sex pain-free. So those are important issues. When I teach, and I teach very frequently on sexual health, in fact, frequently next month, I'll be speaking with over 800 physicians. And there are 7 key areas. So you'll notice when you're a subscriber to my emails, to my blogs, I'm always talking about multiple aspects. And it really narrows down to these 7 aspects of feminine health, of sexual health, of whole body health that we address. Because it's never just one thing. It's never just one prescription, one cream, one pill, right? It's always a combination of things in these 7 areas: physical, psychological, emotional, relational, spiritual, environmental, and medical are all aspects to regain our complete health, our sexy, if you will, right? That vibrant magnetism that each of us has. So to really enhance that aspect of our life, we have to look at all of these things. So as a medical physician, I would have an assessment and a plan for every one of these key areas, because again, it's a whole body approach to wellness. So for those of you who don't know me, I am Dr. Anika Beckman. In my arms here tonight is Sandy, my poochie. She was a little farm rescue and is just a delightful doggy. I just wanted to give you a snapshot of who I am. I am an Emory University trained, board certified gynecologist and obstetrician. I'm also board certified in integrative medicine and anti-aging and regenerative medicine, an expert in women's health and sexual health, and I've specialized in bioidentical hormone replacement therapy and natural alternatives, successful menopause and age management medicine, and I frequently lecture nationally and internationally regarding restorative and sexual health and all areas regarding women's health. I have created Mighty Maca, which is my superfood combination that has over 30 ingredients, very powerful, that work together in an adaptogenic way. And I created Julva cream, the feminine cream for our lady parts that really is transforming women's health. And I'm super proud about that. I also created the online education programs, Magic Menopause. We'll be launching another one soon, so be sure you're on my mailing list to join us in that program. And I've also created Women's Restorative Health and Sexual CPR, and I co-created Sexy Younger You. On a personal note, I'll share with you that I'm a mother of 5, with 1 in elementary school, 2 teenagers, actually 18 and 21 now, and single, divorced, working mom. So not exactly where I expected to be at age 51, but all in to make the best of it. At age 39, I had 4 children. I was definitely a workaholic, the primary breadwinner, doing everything, many hats, right? Many of you wear many hats too. I was mom, I was wife, I was business owner, I was physician, I was scientist, I was researcher. And, again, many hats, trying to do it all. I was also significantly overweight, and I was diagnosed with complete premature menopause and diagnosed infertile when my husband and I at the time desired desperately to have another baby, and was told that I would never be able to. I was depressed. I had post-traumatic stress disorder and absolutely zero interest in sex, let alone life. And one thing I knew that I wanted to do more than survive, I wanted to thrive. I didn't want to be a survivor. I wanted to thrive. And I wanted my children to face adversity in life as they come up against it with grace and perseverance and passion for life. And also that notion to do good, to continue to live life for others, but yet have a joyful existence and a happy existence, that they deserve that. And if I could wish that for them, I definitely wanted to exemplify that for myself. And that took me on a healing journey around the world. Many of you know my story, around the world, and then continuing my journey, because as you know, everywhere you go, there you are. So a lot of self-work to do, spiritual, emotional, etc. So with the transformation, the things that I've learned, and had, and the struggles that I was exposed to, I was able to regain many things, my health, my vitality, and very importantly, I was able to conceive at age 42, my little miracle baby, Ava, and to wake up excited, to be passionate about life, to help others, and to work on the consistency of that, not to mention losing the weight and growing back my hair, because I had a huge temporal baldness on my head, and that was, that's scary. So something that I've taken to heart through working with clients and just in my interactions with people, all of you tonight, is the sense of what Aristotle said, that the soul suffers when the body is diseased or traumatized, while the body suffers when the soul is ailing. And that is so true. And biblically in 1 Corinthians chapter 3, verse 16, it states that, don't you know that you yourselves are God's temple and that God's Spirit lives in you? And so a reminder that we take care of the temple of our spirit, our body. Our physical health is crucial to our spiritual health and emotional well-being and our relational health, that we are designed to be much more than the here and now, the physical, what we see day to day, but to have a greater presence, a more magnetic presence, and this greater connection with God, with spirit. And I really hope to help people achieve that as well as continue to attain it on higher levels myself. So when we come down to this, you know, designed women, how I want to ask you, how important is your feminine health? On a scale of 1 to 5, type this in: 1, not important, but 5, very important. Now, of course, this is a biased little survey because if you're here on this call tonight, I know that your feminine health is very, very important to you, and that you have a sense that it can be better than what it is now, and you're willing to find out what you need to do, and I appreciate that. So I'm glad you're here. We've had many questions come in over the course of this week in preparation for this Q&A. And often these are the questions that we get. One example from Kim said, I am postmenopause and cannot have intercourse due to vaginal pain from dryness. She said, I'm heartbroken to lose that intimacy with my husband. And Teresa said, I'm concerned about incontinence. Should I use the Julva in combination with Kegels, and do Kegels really help? And then Sherry asked, I'm 68 and the vaginal creams, estradiols, don't work. Will Julva? Keith asks, can it help with libido? And then, of course, we hear many fears along the way. Well, I will answer these questions for you tonight because I'm sure many of you have the same questions. Our hormones change and they affect our vaginal health as we go through the course of our life. Over our years, over our decades, our hormones start to plummet and change and fluctuate. And that's a normal transition. But really, as we're exposed to an artificial environment, artificial lighting, environmental toxins, you know, dietary contaminants, etc., our hormones aren't as optimum as they should be, and we can struggle a lot more. And we see these declining of hormones even a lot earlier than we did, you know, 3 or 4 decades ago, so a generation earlier. Men and women have declines in DHEA. DHEA is an important hormone from the adrenals that support our fight or flight response, that support healthy aging, support our immune system, that optimum levels are associated with decreased breast cancer and healthy bones and decreased osteoporosis. So all these things are really important. Optimizing, acknowledging a natural decline, part of hormonal, part of aging, right? In a healthy way, but optimizing the hormones we have. Also, we know that in medicine, men and women are treated under many of the same studies. There are very few studies that have differentiated, but ultimately men and women are different. We are designed different. We react differently to medicines. Hormones react differently in our bodies, and we should not be treated as men. And that has always been a pet peeve. And that was one of the reasons I began women's health and obstetrics and gynecology way back, you know, committing to that in my 20s. So when it comes to vaginal health, it's not, you know, there's still a lot that we need to learn to really have optimum health. And of course, it's more than about vaginal intercourse, but it's kind of fun. This slide's kind of fun. And this slide says, go down a water slide while it isn't wet. Then you'll understand why foreplay is so important. So true, right? So there are changes that naturally happen as we age to the uterus, to the lining of the uterus, and to the lining of the vagina. We lose the blood supply, we lose the beefy red and the folds that come with it, and the lining is thinner, as well as the muscle layer is thinner, and the tissue becomes dry and less moist and becomes more sensitive to tears, rips, again, lack of pleasure, lack of sensation, lack of lubrication, and that can be very problematic. So working in women's health and sexual health, working in urogynecology, understanding bladder health, realizing that we have to rebuild and restore the vagina, and lo and behold, we can, and we can treat that through prescribing vaginal hormones and helping with, Kegel exercises, using muscle strengthening for the pelvic floor. All of that is really important. And when I decided to create Julva as a cosmetic cream for the vulva to help from the clitoris all the way down to the anus, to keep that tissue healthy, moist, have some resilience and resistance, right? We worry about anti-aging around our eyes and lips, but what about our vulva? That area is so important. And keeping that healthy will help decrease some of the problems that are so common with aging, and is part of the reason why I created Julva in this way, and made it so it was clean, a clean product, non-GMO, no phthalates, parabens, gluten-free, toxin-free, soy-free. I mean, just a really beautiful combination that I combined healthy ingredients that really have, over my course of practice and personal and professional experience, really work to help nourish our pelvic floor. So shea butter, emu oil, and coconut oil. I do sometimes, and I apologize for vegans out there that have a conflict about using emu oil, but I will say this up front, that I've used many different carrier oils, but emu oil, and I first had experience with it in Australia when we had some burns and lesions and cut, and learned about the medicinal benefits of emu oil, and that as a carrier oil to help these ingredients, really absorb nicely into the skin. There is nothing that I found that is better than this combination that I've put together, and it does make a difference, and it's one of the reasons why Julva is so effective. Coconut oil, of course, is beautiful. And then the resilience of alpine rose stem cells. So plant stem cells from the alpine rose, which grows in the Alps above, in the ice, you'll see this rose blooming. The alpine rose has been known for its resilience and is a huge, popular, very popular in anti-aging creams, very expensive anti-aging creams. So I definitely wanted to include this alpine rose for our feminine bits that definitely need to age gracefully and have that resilience as time goes on. And then incorporating DHEA, which is the adrenal hormone that we know has tremendous benefits for anti-aging. So a very important ingredient there, as well as some vitamin E, again, as a carrier oil. Julva has been proven very, very safe. I've included some research here, but there's continuing ongoing research that looks at DHEA and has noted healthy effects, including improvements in sexual desire, libido, interest, lubrication, and those are statistically significant with no increase in any adverse effects or significantly elevated serum levels of estrogen or testosterone. And that's important. We want to treat locally the area that's being affected and treat it well and quickly. So again, as we age, the vaginal walls can atrophy and we get that decrease of blood flow and the natural folds and irrigation that are so important. So using ingredients like DHEA can really help with that. Again, we looked at DHEA in women with breast cancer, and we found that DHEA has been found to increase bone mineral density and to stimulate vaginal maturation without affecting the endometrium, in other words, the lining of the uterus. And it has been shown to improve well-being and libido, but no significant side effects. This was done with vaginal DHEA prescriptions. So also animal models have been looked at, and in these instances, DHEA was found to inhibit breast cancer development and growth and to stimulate bone formation. So hallelujah, right? Why haven't we been doing this for a long time? So again, so great safety studies, but more importantly than looking at rat models and research, right? What do other women like you have to say about it from all ages? And I know we have women from, you know, mid-30s to in their 70s using Julva with tremendous success. And it really does pay off. So I'm super excited. You've seen my website. You'll see these beautiful testimonials. You can hear from them yourself. And just thinking about other options, definitely, if this isn't right for you, coconut oil, go to my website and my blog. I do a do-it-yourself vaginal lubricant that has coconut oil and a couple other key ingredients that I really love to help as a natural lubrication, and add some essential oils to help. So there's some beautiful options that you can do. So my do-it-yourself moisturizing lubricant, I have that video on my YouTube channel, and I talk about it in my blog, and then give you one additional secret ingredient to add, and that do-it-yourself moisturizing lubricant becomes a makeup remover, which is super fun. So we can post that link to this video as well at the end of this call. So let's go to questions. I want to go ahead and answer your questions, and I'll first go ahead and answer some of my most frequently asked questions, and then I'll go through, enter your question in the chat box. This is your time to get your thoughts down and write in your question. I'll go ahead and answer those, or you can again raise your hand and you can talk to me live in just a minute. I always get the question about how should I apply Julva, and really with Julva you want to use a dime size amount on the, you know, you can just put a little bit on the back of your hand, about a dime size or pea size amount, 0.5 ml, and then apply that to your vulva. You from the clitoris down to the anus. It's perfectly fine. It's safe for your partner. Always wash your hands. You know, anytime you're using any creams, any solutions, and you have children in the house, you don't want them to have contact with it. So keep a separate hand towel, etc. And that's just good advice. I definitely always give that advice to men who are on testosterone, very importantly, because those dosages are, you know, 10 times stronger than what we're dealing with here. And then again, the dosage is actually 0.5 ml. We're finding that to be perfectly effective, and typically use that amount for 30 days. And then we expect that you'll see an improvement, and then we can go to about 5 times a week. And clients do that. We have some use more and some use less. It's just really going to be getting your peak levels. Now, if at 30 days you still, like I had one client, she goes, man, I still wasn't feeling any significant changes for 2 months. And we said, stick with it. You know, you're getting the moisturizing benefits. And then about 3 weeks later, she emailed us. She goes, I have had the best orgasm in my life. Oh my gosh, I'm so glad I didn't give up on this. So just dropping that seed, y'all. Who doesn't want that, right? Get better? Yes. All right. So I always ask this question: do you 100% understand where your vulva is? And I just want to know from you. Mostly, you've been listening to me, so if you'll just say yes or no on this one, yes V, no V, then I'll know that you're referring to where your vulva is. And if you have any questions, let me know, because I definitely want to make sure you understand that. But when we're talking about the vulva, I always make the analogy of it looking like an orchid flower, right? Gorgeous. You've got the clitoral hood, the hymenal ring, the opening into the vagina, the labia majora, the labia minor, or minora, and that is that's a beautiful analogy to look at the vulva. But really, from the clitoris all the way down to that band between the vagina and the rectum is all part of the vulvar area, and that is the entire area perfectly safe to use Julva. And I always get the question, can I use it before intercourse? And absolutely, it's perfectly safe. Again, for your mate, men typically will use 10 times the dosage with what we're using. We're using a very local dosage that will absorb, because of the ingredients and the carrier oils that I've combined into this formula, very quickly. And if you've used Julva, you know how beautifully it goes into your skin. It really does penetrate, and that's absorbing really well. So and again, it's perfectly safe for your partner as well. I do give 100% 60-day money-back guarantee, because I want you to get the results. I want you to stick with it. I want you to feel it. And let me tell you, we have less than a 1% return rate. We really have high satisfaction with this. And again, a lot of science went into it, a lot of clinical experience went into this, and I think that's part of it. That if you're hesitant, just know that I've backed this with a 100% money back guarantee, so you're not out anything for trying it. Again, the question that, can it be used by men? And believe it or not, I have many men that are using Julva either alone or with their wives because they've had issues of, thinning genital skin, loss of erection, and want a little bit of help. So they are a growing group of male fans, so it definitely doesn't hurt them. And the same thing with oral intercourse; it will not hurt. The ingredients are safe enough, and plus, again, it absorbs very, very quickly. Now, I get the question of, should I stop my estradiol? Should I stop my testosterone? Should I stop my birth control? Should I stop this or that or the other thing? No, Julva can be used along with any of your medications. So don't discontinue anything without your doctor's guidance, and this includes your hormones. Now, one experience that I've had with a lovely client who's a Julva fan, she asked her doctor, should I use this? And he's like, I don't know what that is. And the client introduced me to her doctor through email, and a 5-minute phone conversation. He is one of my biggest fans of Julva right now. So getting that clinical experience, getting this to your doctors, again, so that they can be aware of what this is and the science behind it. Don't hesitate to send me an email, make an introduction with your doctor. I definitely am getting samples into my physician colleagues' hands to have their experience, and we continue to get great results. Now, when we go from the Sahara, I always get the question, we're going from a vaginal dry area, vulvar dry area, and between the leg, dry, cracked skin, and now we're creating moisture. You do have potentially an increased risk of yeast infection. We don't get this very often, and in fact, quite rarely, because again, coconut oil is a nice little antifungal combination. But occasionally, again, going from the Amazon and going from the Sahara to the Amazon, we're bound to get some dormant increase in yeast or bacteria. So if you're having those issues, just stop the Julva for a few days, use an antifungal like Monistat or Diflucan, get that fixed up, and then continue back to keep that tissue healthy. Take some oral probiotics, and that usually nicks it in the bud, okay? So that's it. I do want to address who shouldn't use Julva. So this is really important. If you're pregnant or breastfeeding, consult with your doctor before using this product. If you're taking the prescription tamoxifen, do not use this product without your doctor's permission. If you have a vaginal infection, consult with your doctor before using the product. And if you had or being treated for breast cancer, again, consult with your doctor before using this product. Keep this out of the reach of children and discontinue its use if you experience discomfort or ongoing irritation. Now, there's a caveat to that, because initially, sometimes as we regrow healthy tissue, you may experience initial irritation. That just means back off, go slower. Just like if you were to use a chemical peel, a vitamin C peel, which I just did recently, I'm a little red, but you'll have a turnover of skin cells. Well, we're going to experience some of that too, a sloughing of those cells as we're working to moisturize and enrich the pelvic floor. All right, y'all, it's your question. You are on. So let's look at that, and let me go ahead and answer your questions. I did hear just some slides that compare other over-the-counter, but needless to say, like Julva outranks them all, of course, right? It absolutely outranks them all, and that includes when we're looking at hormone replacement therapy. I definitely recommend Kegel exercises or using Kegel balls in addition to Julva, just to improve the pelvic floor, and I can certainly go through this a little bit more. Now, one question is about the cost. Now, Julva, our tube of Julva is a 60-night tube. And so for 60 nights, it's $69.95. Now, we're offering you a special rate, especially as a VIP subscriber. That is very limited. We are just want to get this and get as many of you connected and able to really see the benefits that you can experience with Julva as comfortably as possible, and to make this as accessible to so many of you. Many of you know that we'll pay over $100 for an eye cream. We'll pay over $100 for a prescription bioidentical hormone or a vaginal cream, and for a 30-day supply, right? That's the going rate. So for almost half that cost, for 60 and twice as long, I've made Julva available to you. And again, I'm just passionate about getting it to you and hearing how well it works for you, because we want to lose the problems that we're having and we want to gain our sexy back. So, so you're in. Let's go ahead and let me answer your questions, and flip back here. Oops. Here we go. That's a good slide to end on, right? Here we go. There we are. All right. So let me go through and answer some of your questions. And we have from Susan, how does Julva help incontinence? So again, if we're having, like, if we can just look, you know, our wrinkle lines, laugh lines, there's gaps, right? There's loss of elasticity and moisture, natural moisture, and the health of our tissue. The urethra, from where we urinate, right, is just tissue and mucosa. So as that gets wrinkled, aged, losing muscle strength, losing the elasticity, and that can create leaking, a loss of strength, a loss of healthy integument, right? Healthy skin, healthy mucous membranes. We tend to lose urine. That, for those reasons, Julva can help, because it's moisturizing, it's enriching, and the ingredients with Kegel exercises help to strengthen the pelvic floor. So you're strengthening those muscles that are part of the weakening, right? If we don't do our push-ups and sit-ups, our muscles are going to atrophy, right? Same thing with our pelvic floor, and that's really important. So that's one of the reasons that Julva, we hear from so many users that Julva improves their leaking. So women who had stopped running now are running, or they were running with pads, now they're doing it without pads, or using their rebounder, trampoline, being able to use that comfortably. For me, it was jumping rope, you know, as part of my warm up. Like, oh my gosh, did I hate to jump rope? Now I can jump rope and not worry about it. So, except that it's exhausting, but things like that do make a difference. And if those are going to inhibit our quality of life, you know, we've got to stand up for it. And the answer is not getting incontinence pads. I don't care how cute they are. There's incontinence panties. Like, give me a break. No. And one thing that I do always say is that incontinence is, you know, the research shows that incontinence issues is one of the reasons that caregivers will put their parents in nursing homes, right? And I certainly do not want to give my kids, especially, you know, after those teenage years, any reason to put me away that they may already have, being a tough mom. So you hear me on that one, right? All right. For some women, Susan, it does help decrease the frequency, the urgency symptoms, because there's not so much irritation down there. You've got healthy tissue, and healthy tissue is less irritated. And so hence that will trigger less urgency symptoms. Now, if you're having urgency symptoms, there's other things that we need to do. And I just wrote a blog about that recently, such as cutting out the caffeine, you know, and other, you know, different foods that can trigger urgency symptoms, food coloring, preservatives, etc., that all work negatively. So it's always a combination of things. I don't want you to lose that. Again, no magic pill. We've got to do the whole body approach, those 7 key aspects to our sexy. We want to address all those and look at things in the environment that could be causing that problem. Are you using detergent that could be irritating your urethra and your bladder? Could that be part of it? So I think there's many more things that we need to address when it comes to those issues. But this certainly, again, is worth a try. All right, let me look here. Yeah. So one thing that I talk about too, regarding the frequent need to urinate, and is, you know, something. One of the reasons I became so passionate now. Let's see, Amanda's 21, so 15 years ago, I was in the kitchen preparing dinner, and I was post call. Amanda came to me, and she said, Mommy, I need DETROLLA. And I was like, what? That's a bladder drug called Detrol LA. As a gynecologist, I prescribed that, you know, I did unhesitantly, right? And she'd seen this commercial with urgency symptoms, having to run to go to the bathroom, needing to get up in the middle of something and go use the bathroom. And she goes, Mommy, I need that pill. That's me. And I was appalled. I was appalled that my 6-year-old daughter was being brainwashed to have a prescription. I said, no, honey, you know, no more caffeine, no more sugary drinks. We stopped gluten, we stopped preservatives, we stopped sugary drinks, Sprite included, etc. And lo and behold, those symptoms went away. And that just really, so 15 years ago, really empowered me to take that personal commitment into my practice and to dig deeper into the underlying reasons for the symptoms that my patients were presenting with and to find creative ways to help them. Make sense, right? Yeah, so we have to look at it that way. All right, y'all are committed to getting your feminine sexy back. I love it. And let's see. Barb says, I currently take a prophylactic dose of antibiotics after intercourse to avoid urinary tract infections. Will Julva help me avoid taking this medications? I have heard from several clients that this has helped. I definitely understand that especially when the urethra, during intercourse, you can push bacteria into the urethra. So getting up after intercourse and urinating is one way. Taking high dose vitamin C, 4,000 milligrams a day, is another way to decrease your urinary tract infection. And then keep this tissue healthy. Apply Julva around the urethra, all the way, the clitoris down to the anus, right? Definitely around the urethra. And get that healthy restored so you've got that elasticity and it's not just a vessel for bacteria to penetrate, okay? So get that tissue healthy again, and definitely try Julva. And please, Barb, let me know how you do with it. I believe it does absolutely help. Okay, and Felice says, thank you for creating clean and pure product with beneficial ingredients and no toxins. Love that. And then the question, does one must use Julva? So it's that for hormones. Should you be on them forever? And I definitely have had patients in their 70s and 80s on bioidentical hormones, the right patients, right? And so like, do we use anti-aging skin creams forever? Do we use, you know, do we eat healthy forever? Do we exercise forever? Yeah, I mean, why not? Is our age going to limit us? I mean, I think we give up on all those things when we throw in the towel, right? So until then, I think let's keep doing the next right step to get healthier, to live better. You know, don't let our years limit us. So, all right, and it just brings me to think about my daddy, right? At 79, when he was 79, I was told we should just, you know, I mean, he's lived a good life. He's lived a long life. He's 79. They told me, Anna, he's 79, you know, he's lived a good life. You know, like, what else can we do? And I'm like, that's when I took over my dad's care. At least I contributed to my dad's care. Well, you know, he made it another 12 more years, and we just buried him this year at 91. Still smart as a whip, great sense of humor. He got to see his grandchildren. He got to see his grandchildren grow up. And, you know, you can't beat that. And I definitely kept him on hormones and many supplements through the remainder of his years. So I think that's key. Now, Debbie says, question, are facial hair, whiskers like a man, and male pattern hair thinning contraindications to using your vaginal Julva DHEA cream? No, it is absolutely not. I mean, we will age, we will get hair on our face and peach fuzz as we age without any additional hormonal support, right? The key thing is that we balance the hormone support. So I always recommend my clients, they can use some of my progesterone cream around, you know, facial areas, under the neck. That's perfect. Use the Julva down below. That'll keep that area healthy, and very little gets systemically absorbed. So, yeah, so thank you for sharing, Debbie. And you're not alone in this experience. Debbie writes, just had a pap smear and just the speculum insertion and expanding was painful. Hence not having any sexual relationships with my husband. That's, you know, I mean, why would you? If it hurts every time you have sex, why would you want to have sex? I mean, if you go up to play baseball and you get hit by the ball every time you get up to bat, why would you want to play baseball, right? You just wouldn't. And the same thing, believe me, I know, I'm a gynecologist. I've treated over 10,000 women. The vaginal area gets thin and dry. We can restore that. I've seen it. It happens. I had a client whose gynecologist said he wanted to carry Julva because he saw her after a year and her vagina was perfect again. Used the speculum, no pain, no problems. And in his notes, he had before very atrophic vagina. On his recent clinical exam, she was, completely healthy, and her speculum exam was painless. So, and yes, her sex with her husband is pleasurable. How wonderful is that? They've reignited that intimacy. So I want that for you too. It's certainly possible. All right. So Lynn says, should I also put it in my vagina or just on the outside? And so that's a great question. Again, I said Julva is safe formula. I mean, it can be ingested, right? It's safe. Do not eat Julva. Why would you eat Julva? The spoon is not for eating. You get the tube of Julva, right? It is not. But it is designed, again, perfectly clean. Topical, absorbs really well into the skin. Applying it externally is perfectly fine. If some gets in the vagina, no problem. It's pH balance. But it is designed for external use. So that's what I've studied, and that's how we're using it, and those are the results that I can speak about. Okay. Let's see. Oh, best Kegel exercises. When you get Julva, one of my videos to you is how to perform the absolute best Kegel exercises. So you'll get that. I think there's a combination. You can definitely use Kegel balls, Lilo balls. You can email my staff. They can give you information on that. But doing the pelvic floor exercises is very good too. Jade balls or jade eggs are another option to use, something to weight in the vagina. So there are different ones that can be used to help just stimulate that contraction vaginally. Absolutely, definitely do that. All right, and let's see. Question. Do I sell samples to medical professionals to give it away to patients to try it out? Yeah, so for my physician colleagues in OBGYN, email me. I will send you samples, absolutely. And you can also, we also have wholesale account for medical professionals that they can sell Julva in their office as well. So yes, all right, let's see. So Debbie's raised her hand. So Debbie, we're going to go ahead and unmute you, and I'm going to answer Diane's question about lichen sclerosus. Now, lichen sclerosus is very tricky. We typically see, 2 peaks of lichen sclerosus in our 20s and in our 60s, and it's painful. We call that cigarette paper skin, that thin, that thin white parchment paper, and it's very painful. We are hearing that many clients are feeling symptomatic improvement with using Julva. So I'm very pleased of that. When you have lichen sclerosus, it is definitely something you want to discuss and get treatment from your gynecologist for, and to look at any underlying things. All the things that I recommend from my keto alkaline diet, healthy omegas, probiotics, using Julva, balancing our hormones, decreasing inflammation to the cellular level is really important to help address that. And when you have something like this, or any autoimmune disease or any inflammatory disease, we have no wiggle room, right? It's like getting a diagnosis of breast cancer. That's like, in our face, our body is struggling to heal itself, right? Our body is naturally able to heal itself, but it's struggling. So that really brings us back to the core principles. And I go through that, 8 weeks in our Magic Menopause program, really want to get grounded in those core principles so we can adapt them into our life consistently. And I have to say that when we have a group of accountability group, when we're on with our community of women and we're going through this together, there's a heck of a lot of compliance and really beautiful change and transformation that happens in community that is just beyond this. So I hope all of you will experience that with me and come through the transformational Magic Menopause program when I launch it again. So great question. All right, Debbie, you've raised your hand. Tell me what question do you have here, dear? Don't be shy.
Dr. Cabeca?
Yes.
I'm sorry. I meant to lower my hand. I didn't know about this program or how it works, but I was the one that wrote in about the problems with the facial hair and the other issues. But
Did I answer
So
your
it's,
question?
yes, I have more than just a few little chin hairs. I literally have to shave every day. Otherwise, I have a slight beard like a man. So will this be okay still even with that?
Yeah. Have you tried some of the prescription formulas to help with hair growth, facial hair growth?
I have not tried anything at all, nor been tested for hormonal imbalances or anything like that, other than just simple blood testing, which has always showed normal. So I've just been struggling with this for years, and yet now that I'm older and gone through menopause a few years ago, I'm having issues down below as well, and I'm having at least an inch of hair loss underneath my bangs and my temples, almost like I have the male patterned baldness as well.
Yeah. So one of the things is you can use the bioidentical progesterone on those areas. Just a little bit can go a long way. That can help to stifle some of that facial hair growth. So we've had some good success with using bioidentical progesterone there. The other thing is that you may be a rapid converter to dihydrotestosterone. So zinc. There's also a product by Zymogen called Testoplex. We used to sell it on our site under Pura Testa Libido, but that helps keep testosterone free and keep it from converting. So that may be something that you can do. And Vaniqua is a prescription that can be used also to help that hair growth. And then, of course, there's laser hair removal to help just completely shut down those follicles. So those are some options that you can try to see, but definitely should not increase your hair growth at all.
Okay, so as far as that, the feminine problems, I can use your Julva and I can at least correct that issue. And then you've just given me a wonderful list of things to try, because so far over the years, the only thing that people have recommended is Spiro. Yeah, and I just didn't want to get into taking a diuretic. I like to do things as natural as possible. And it's been going on for years and years, getting worse and worse. So I appreciate all these other suggestions because they seem a little bit more natural versus going hardcore and being on a diuretic for the rest of my life.
Yeah, yeah. And, if you have a good compounding pharmacist in your area, so the Association of Compounding Pharmacists called PCCA is, and you can look at their website, PCCA RX, but if you find a pharmacist in your area, I know they have some really great formulas for specific problems that you could ask your physician to write, discuss with your pharmacist who's prescribing that in your area, and get some of the topical, so maybe a topical solution versus taking something internally to, address the area versus entire system, right? So there are a few things you can do to connect with your compounding pharmacist to find some solutions to help with that. And
could
then
you spell
laser hair removal?
Can you spell the Zymogen?
Yes, Zymogen, Xymogen, and it's called Testoplex, Testoplex. I love that product for both men and women. It keeps testosterone free and available, and it's an all-natural combination that's really good. Yeah.
And then what was the other one you mentioned as well? There was another name of something besides that one.
Yeah, so there's Vaniqua, and I think it's Vaniqa. I haven't written it in a decade, so I'm trying to remember. There's another doctor on the line. If you've got any suggestions, please just type those in. We'd love to hear your input. So that's another thing. And then zinc, of course, we want to add 50 milligrams of zinc to help with testosterone to dihydrotestosterone conversion. And then we use our Pure Balance cream, and you can just apply a little bit to your face, and that may help decrease that a little bit. So
can I apply that without any testing of hormones and be okay?
Yeah, I mean, pretty much. How old are you, if I ask?
50, gosh, I don't remember. I just had a birthday, 53.
Yeah, and a little bit goes a long way. So
okay. And anything I can do, can I apply that to my scalp as well? Your progesterone, will that help the hair loss?
I don't think it'll hurt. So
Okay.
it's, when we talk about progesterone for our pregnancy hair, that's one of the reasons we get this beautiful pregnancy hair. So we have
Right.
really good research looking at progesterone topically applied, whether or not it increases hair growth. I can't think of any studies that have looked at that, but it is,
Okay.
anecdotally something that we've done. And again, when we had hair loss issues, I really find that it's getting a handle on inflammation, extended intermittent fast, getting keto alkaline, getting our body detoxed, and those aspects really help balance our hormones.
Okay.
Yeah,
Okay. Sounds like I have a long road, but at least I've got a few little tidbits I can start with now. So I really appreciate it.
absolutely. Thanks for being a good sport. Thanks for coming on live. All right, someone else raise your hand. I want to hear some more people. So nice. Nice to hear your voice, Debbie. Nice to see some of your faces. I see some beautiful smiles. I peeked through. All right, Christine wrote here, 86-year-old mom has lichen sclerosis, but also has breast cancer. Well, is she currently on tamoxifen? That's what I would ask Christine, because that would be my only, again, this is a topical DHEA. It's not an oral DHEA. And the research that we're seeing is quite favorable, even in clients who have had breast cancer. There's research with vaginal DHEA prescriptions that have been quite favorable, but it is definitely something you want to speak about with your doctor. And vaginal, even prescribing vaginal DHEA or vaginal testosterone. But external lichen sclerosis could definitely benefit from Julva, just to relieve some of those symptoms. Can be very beneficial. Yeah, so great. Thanks for asking, Christine. Your mom is lucky to have a daughter like you, concerned about her health. Good. All right. Let's see. Anyone else? Hands raised. Josh, you see anyone? Let's see. Philly Liz says, how is the Julva application different from hormonal therapy through injections? So the hormonal therapy, when we're talking about injections, testosterone, for instance, it really depends. Like I'm not against testosterone pellets or testosterone injections. I think they all have a place, right? Through physician prescriber monitoring, because we're definitely getting systemic levels, elevated levels systemically of hormones, and they can work wonders, right? But injections have peak and valleys. The idea with Julva is just a topical cream to have consistency, to have good absorption, to really be anti-aging to our vulva and our whole perineal body, to give that some loving care and attention. So it's very different. We're really not addressing your hormone deficiencies with Julva. We're really working as an anti-aging cosmetic cream for the vulva. So great question. All right. Lynn says, I'm signing up for the VIP order tonight. Absolutely. Awesome, Lynn. Yeah, absolutely. You can cancel at any time, but you will not want to. You will not want to. So congratulations. Thank you. I'm super excited for y'all. And definitely you get my ebook now, which is really, really good. And I've had, again, very timid to send my ebook to even some of my very esteemed medical colleagues, but you saw in our email out today what my dear friend, Dr. Ellie Campbell said. So this is a must read for every woman. Every woman needs to read this book. So I'm really, that's the highest endorsement from someone I highly respect in the field. And to get that endorsement, I was very, very pleased. Again, there's no magic wand, no magic pill. We have to approach our health from a very educated perspective, knowing our body, knowing our limits, knowing our strengths, addressing our weaknesses, and doing that to the best of our ability. So as I continue to create products and programs, I keep that in mind. Like, what's the next best thing that we can do for ourselves as naturally as possible? So there are many aspects to whole body healing in addition. So I feel very committed to empowering you with that knowledge and that information, right? You don't get that from VMagic or from Replens or from Estroven, right? They're not giving you any other information except take this product. But I want you to be empowered. I want you to have this information. I want you to share it with your friends, with the world, with your moms, with your, cousins, with your sisters. I want you all to share this information and continue to be empowered and not to be afraid to talk about what's happening. Because, seriously, it's putting people in nursing homes, right? It's putting people under many times unnecessary or preventable surgeries or, prescriptions. So let's use those tools when we absolutely need to as the last resorts they're intended to be, not as primary preventative or, treatment for early symptoms. Let's address this and get this healthy. And we're women, we're strong, right? We're powerful. We have the ability to heal ourselves, heal our bodies, and to do so much good in the world. So that's my commitment to you, is that I'm going to keep doing my best to bring you the best information, the best knowledge, and the best product. So I commit to that. And then I put the onus on you to take that one step further in your life and to spread that word and spread that message, and then share with me your results. So look forward to that. All right, let's see. Oh, Josh, can you unmute Phyllis?
Dr. Cabeca.
Oh, yes.
Hi, doctor. I purchased your Julva in May. And my question is that when you said in your presentation that in the beginning you will feel some discomfort or some itching, irritation. I stopped after a month of using it because I started feeling irritation. But then I went back to it in August and I'm feeling much better. So was a side effect that I had, or can you explain a little bit more of what would have caused that?
So often, like I was saying, when we go from dry skin, when we start to turn over into, rejuvenating that area, just like as if we had a facial peel, we'll have a rawness and irritation sometimes. If you've ever had a laser peel or a glycolic peel, a little bit strong, and then depending on your body and where, how the tissue is, how much needs to be turned over, right? We want to get rid of the old and regenerate new healthy cells. We want to encourage healthy regrowth. So many times some clients will feel this slight irritation, or even sometimes a light burning. I hate to use the word burning, but irritation is a good word. And also if there's been dormant yeast, that's going to overgrow and further irritate the skin. So I typically would recommend a client to use Monistat vaginally for 3 nights and see if that helps, and then restart the Julva. So if there's a yeast component there, to restart the Julva, or go back to half the dose or every other day because it was too much too fast for what your body needed at that time. Does that make sense? And now you're a little bit more repaired, maybe a little bit on the healthier side down there. So your body's already benefiting at this level. So I definitely see that. Yeah. Great.
Thank you for that. I thought that the Julva had cost it, but I really enjoy the Julva, and I didn't want to stop using it. But I stopped, and I don't know what you think about this over the counter, the hydrocortisone. I used that. I don't know if that should have been a good move because I did not know about the Monistat.
Yeah. I mean, if it wasn't cortisones will typically aggravate a yeast infection. So, but it definitely will it'll calm down any irritation. So if it was a steroid with an antifungal, that might be better quicker, but just the antifungal is usually what I recommend, and that does the trick. Yeah.
All
So
right. Thank you
for trying it again. I'm proud of you. Thank you for that feedback.
Thank you so much for creating it. And I've been having a lot of problems with vaginal discharge and libido, not feeling anything, no desire to have sex with my partner in any way or form. So hopefully this will help. And I'm hoping to give you a really positive review because I'm going to join the prescription, the auto delivery with you guys. So.
Wonderful. I'm excited. Thank you. I look forward to hearing from it. And then too, with the libido, the mighty maca, again, inside out, outside in,
Yeah. I also purchased the mighty maca and I love it. Love it. Yeah.
Good.
I love it. And I just want to say thank you also for your podcast. I love listening to you and the interviews that you do with, very intelligent women that share a lot of things that I never knew about. And it's just I'm just happy to have met you. So thank you so much.
Thank you. Thank you so much. Thanks for sharing tonight. Appreciate it. Yeah, let me know how you do. And yeah, the subscription is once every 2 months, you'll get the tube. So we do have some clients, again, that use it more and some less, but our subscription is for once every 2 months, and that typically rounds you out quite nicely. So,
Okay, thank you so much for answering and talking to me. And thank you, Josh, for unmuting me.
you're welcome. And let's see. Josh, you want to unmute Jocelyn? Jocelyn, are you unmuted? Galaxy Note 5? Anyone else want to ask a question? You can just unmute yourself and speak out. Have I answered all your questions? So, Jocelyn? Let's see. I think you are unmuted. If you want to ask a question, you can. Anyone else with questions? All right. So I think if I've addressed all your questions, I'm super, again, grateful for all of you to be here tonight. And I look forward to hearing your results with Julva. And don't forget, I mean, we really have this unbelievable offer, 35% off Julva for the VIP subscription starting out. And really, this is a fantastic offer. I mean, our team was just very enthusiastic to get this out to all of you, to get you to experience the benefits, plus the ease of use. And just like Felice said, it's like sticking with it can make a difference, right? You can feel better. And so many clients I've heard, some feel improvements right away from the 7-night trial. It's amazing. I really just am thrilled when I hear those comments. And I know like we're going to get the real fantastic results with continued usage. That makes all the difference in the world. So I look forward to your feedback. I look forward to your results. Oh my gosh, and your testimonials, and definitely connect me with your doctors. I want them to see the benefits that you're getting, and then also to share that with other clients. So spread the word. This offer is, I think we have one more day for this offer. And yeah, so again, I look forward to your results, and thank you so much for being part of my community.
Hey, Dr. Anna.
Oh, yes, Josh.
Okay, just a couple more people actually. Jocelyn can't figure out how to unmute and speak. Sorry about that, Jocelyn, but if you just type your question, we'll be able to address it. In the meantime, Debbie also has a question, and she is unmuted at the moment.
All right, Debbie, shoot.
Yes, Dr. Cabeca, do you ever do phone consults out of state? Should I need more information or want to work with you?
Yes. So you can just email my team@cabecahealth.com, and you can arrange a phone consult with me.
Okay.
It's a coaching call, and out of state, I do not do any prescribing or take, no primary care, but definitely second opinion, guidance. I am happy to help you with that. Reviewing labs, help with giving you direction, consult on best next steps. Absolutely. Yeah.
And so I already have some labs ordered. Do you actually recommend labs to have done Okay.
I do. So I have a full panel that I recommend. So you can either do it through the site that I'm going to recommend or through your physician, but it's at ultalabtest.com. And I'll type that in here, ultalabtest.com/Dr. Anika Beckman, and you'll see my VIP panel. And that's, oops, I sent it privately to April. I don't know why, April, I'm sending you privately. Here, let me switch that. So, ultalabtest.com/Dr. Anika Beckman, and you will see the full panel that I recommend. There are 4 key labs that I always recommend up to the elite. I wish every woman to have this full panel of testing periodically throughout their life as guidance. So I think that makes a difference. So there's some key labs in there that I definitely find incredibly beneficial. So.
Okay, and that's bloods mostly, or do you like the salivas?
That's just blood, but I'll evaluate saliva, urine test, Dutch test, all your genetic tests. I mean, I'll evaluate what you have. Yeah.
Okay, great. Wonderful. Thank you so much.
Thank you. I look forward to talking with you.
Thank you. Me too.
All right.
Okay, Jocelyn's question is in the chat box right now.
Yes, I see it. So Jocelyn asked, does Julva help with Bartholin's gland irritation? So I think keeping the tissue healthy is going to be very important. The other thing I would think about with recurrent Bartholin glands, sometimes like what we do as gynecologists, we actually have to remove the cyst wall if you're having a recurrent glandular problem. But definitely worth a try with Julva, just keeping that tissue healthy, having natural lubrication, natural exudate, having that ability to drain just fine should make a difference. The other things is, taking, longer baths with Epsom salts, again, with heat, just encouraging natural drainage from those glands. But if it's recurrent every 3 months, I'm wondering if there's not some scar tissue issue and that the cyst walls need to be removed. So it won't hurt for sure. And, let me know how you do, Jocelyn.
And then we have Rhonda. So I'm going to unmute Rhonda here.
All right.
That's
Okay,
me.
Rhonda, you're on.
Okay.
Hi, Rhonda.
Hi, how you doing? I just wanted to thank you for just being a wonderful gynecologist, because I heard your podcast with Kara Fitzgerald, and sorry I'm crying, but I just was touched because you two just knew so much, and I could tell that you kept up with everything. And I was just wishing that, I live in Salt Lake City, Utah, and I don't think we have that kind of upscale gynecologist here that would know everything like you two are just going for it, and I just think that's wonderful that you care so much.
Thank you.
And that's hard too, because I know it's an emotional thing when you've got all these women asking all these questions and always having to be on guard, and have the answers, because I'm in kind of healthcare too. So just thanks.
Yeah, thank you. Thank you so much for sharing. And I appreciate you. And I just have to think that I'm sure there's someone in your area. I mean, for heaven's sakes, I'm in Southeast Georgia. The last place you'd expect to find someone.
Yeah. And I know you were foreign on an island or something like that.
Yeah.
Yeah.
So, National Health Service Corps brought me here as a National Health Service Corps scholar, and then just figuring out what can I do for my clients that doesn't cost so much, that, underserved. I mean, there's incredible, and all of us, as busy women, we're the last on our list often. So we underserve ourselves, doesn't matter our income bracket, right? So finding tangible solutions that we can fit into the quality of our life is huge. I mean, for me, raising kids, it's that it's been a long route, right? And we want to do what's right. We want to inspire others and have that balance, especially in the medical field, have that work-life balance.
Yeah, self-care too. That's so important.
Mm-hmm.
So,
well, keep it up. Thank you so much.
Thanks.
Well, I thank you all very, very much. It's been a blessing to spend this evening with you, and I look forward to your results with Julva. If you have any other questions, let me know. You can always email our team. You respond to any of the emails. If by chance we don't get back to you right away, just email us again. Sometimes, we are human, but we really work to get back to everyone in a very timely fashion. As you'll see, I have incredible customer support. Lori and Jami are just amazing, and they're here to help you. So we want to hear your results, and we want to see your results. I look forward to talking with you. Let me know how you do. Definitely get this offer now. It expires, and there's no plan to offer it at this rate again. So I appreciate you, and help me spread the word about Julva. Help me get your doctors on board and your other practitioners on board. And I look forward to it. Thank you. Good night, y'all. God bless you.